Thank you, Stephanie, and good morning or good evening to everyone. So, as Stephanie said, I'm a neonatologist, and what I will discuss now is shortly, just 10 minutes, what is important for neonatologists to know about TAPS. And most of you are parents, so well, what is important as maybe future parents, or if you have been a parent, to know about what happened or what should have happened during the first period after birth, if your babies had TAPS. So we are, as neonatologists, often called to the delivery of twins. That's normal. And sometimes the babies have different colors. One is white and the other one is red. And I cannot, oh yes. And that's more or less how the babies look like. Huge difference in color. And it's always a shock at the first moment, because especially the one that is pale often looks very pale. And well, doctors then get worried. And the things that you have to know at that moment as a neonatologist is, first, are these twins monochorionic or dichorionic? Because if they are dichorionic, they have two not shared placenta, and these placenta do not have vascular connections, and these babies will not have TAPS. In very, very, very rare situation, you can have a dichorionic twin with TAPS, but this is extremely rare. But first know if they are monochorionic or not. And if they are monochorionic, then there are two things that could have happened causing the color difference. It could have been an acute transfusion of blood from one baby to the other. This is what we call acute peripartum TTS, meaning acute shift of blood during delivery. But usually, and most often, it's due to a chronic transfusion of blood from one baby to the other. And this we call TAPS. And that's why we talk now about TAPS, because that's the most frequent cause of this color difference. Now, what do you need to do at birth if you think about TAPS, if you know about this disease, is not only measure the hemoglobin levels, because you can measure that in a lab and you will see that the hemoglobin is low in the baby with the anemia, so with the pale skin color, and high in the baby with the more reddish skin color. But it's very, very important not to stop there, but to also measure the reticulocyte count. Reticulocyte count is a kind of a red blood cell, but very young red blood cell. The hemoglobin is the one that gives us the color that we have, but the reticulocyte count, you cannot see if it's low or high just looking at the skin color, but you have to measure it. And we often forget to measure it. And what it shows is that in case of a chronic anemia, your own body starts producing a lot of red blood cells to compensate for the fact that the red blood cells are low. And these young red blood cells are called reticulocytes. And so in case of TAPS, the baby with the low hemoglobin levels will have produced a lot of young red reticulocytes, and these will be very high in their full blood count. And in the opposite, in the co-twin with the high hemoglobin level, this reticulocyte count will be normal or low, but not increased. So this difference in reticulocyte count is very typical for TAPS. So we always ask doctors, if they call us with the question, we have a red and a white twin, remember to not measure only the hemoglobin, because that's the first thing you need to know. Sometimes the color difference is not due to an hemoglobin difference, but if there is an hemoglobin difference, then also measure the reticulocyte count. Why is it important to make a distinction between TAPS? This is the chronic form of blood transfusion from one baby to the other and make a comparison with the acute form of TTS, well, both of them have a high difference, a large difference in hemoglobin levels, but the difference is that, as I explained you before, the reticulocyte count will be high in the donor with TAPS. So if you divide the reticulocyte count from the donor by the reticulocyte count from the recipient, you will have a high ratio above 1.7 in case of TAPS, and this will not be the case in babies with acute TTTS. Another way to see if it's an TAPS or an acute TTS case is look at the placenta. You can do two things. If you are an experienced doctor who has experience with looking at placenta and injecting them with colored dye, you will find that the TAPS placenta have a very characteristic aspect in which they have only a few very tiny anastomoses, whereas the placentas from babies with acute TTS have large anastomoses. To see this difference, you really need to inject them, because that's the easiest way to really know for sure that it's a large anastomosis or not. If you don't have the time and the experience to inject the placenta, we always ask the doctors to at least flip around the placenta and look at the back side of it. And what you will see in TAPS placenta is that you have this huge color difference like in the children, but now on the placenta. You can see here in the picture below, this is a TAPS placenta in which one side is very dark red from the recipient and one side is pale from the anemic donor. And this is a placenta from an acute TTTS, and you see there is no color difference between the two placenta shared. So that's an easy way to make a difference between the two. Why would you want to make a difference between the two, between TAPS and acute TTS? Well, because the management after birth is different. In case of TAPS, this is a chronic situation. So the baby that is anemic is actually looks very pale, and sometimes so pale that you almost frightens you, but they are stable. They are used to the low hemoglobin and the low level of red blood cells, and they are really not too much in trouble. They need a transfusion often because their red blood cell is too low, but you can do that in a slow way. There is no hurry. You can really type and screen the blood and have a safe red blood cell transfusion. In case of acute TTTS, it's different. The baby that is anemic lost blood in a very short period of time, and this baby has a low blood pressure, a high heart rate, is not feeling well at all, and you need to treat that baby quickly. The recipient in both cases are very red, and often in TAPS you need to do an exchange transfusion to lower the level of red blood cells, but it's not something that you need to do acutely. The big difference is for the donor. In the donor, take your time in case of TAPS and be quick in case of acute TTTS. Now, the most important thing that neonatologists must know in case of TAPS after birth is that it's very important to do a hearing test in the donor. And this is because we found out, and Dr. Van Klink will tell you more about that just in a short while, is that 1 in 8 of the donors unfortunately suffer from deafness. And the sooner you know about that, and the sooner meaning at least during the first weeks after birth, the earlier you can intervene and avoid the babies growing up with deafness without anybody knowing it, because these babies will have more delay in their speech. So it's important to do hearing tests in case of TAPS, in both, of course, but the ones that are at risk are the donors. I guess that these were the most important things I wanted you to remember. So first, measure the hemoglobin level and the reticulocyte count. And the reticulocyte count is something that we often forget, so that's why I emphasize it once more. Have a good look at the placenta. It's also something that often neonatologists, actually also gynecologists, sometimes just don't have a really good look at it and just, well, a quick look and then throw it away. That's a pity. And beware of deafness in donors. So do a hearing test in these babies. You will help them a lot.